Good afternoon. As we continue through this unprecedented health event, your safety and the safety of our patients and visitors remain our top priority. We have taken a number of additional steps at both Cabell Huntington Hospital and St. Mary's Medical Center to ensure that safety. We have implemented a no visitor policy with few exceptions. We have restricted access to the hospitals, clinics, and emergency rooms, and we're now screening patients, visitors, and staff before entering our facilities. Also in compliance with the governor's mandate, we have temporarily suspended non-life-threatening surgical procedures. This means we're not performing services that can be postponed to a future date, but not be harmful to patients. Unfortunately, while this measure is having a positive impact on our preparedness, it's having a negative impact on our budget and will require us to tap into cash reserves to fund this event. As you well know, hospitals run on low margins and cannot absorb this drastic reduction in revenue. To responsibly respond to the pandemic and our low census, we're enacting temporary furloughs for several staff members across the system beginning next week. I want to emphasize these are not permanent. We are responding to our low patient census and flexing down staff. This is a difficult decision, but a necessary one, and we are not alone. Many other organizations and businesses across our state and country are making the same decision right now. We must take steps to ensure the system is positioned to not only address this pandemic, but also the future. The time period of the furlough is unknown right now. The next 2 weeks will give us a better picture of the extent of the outbreak in our area and the duration of the government-imposed emergency mandates. We'll continue to support the directives we receive from our governor, which will undoubtedly drive our decisions. We will continuously evaluate the situation with the goal of returning to full services for patients and getting staff back to work as soon as the pandemic declines and the state government will permit. We regret that this decision will affect many people economically and are making adjustments to reduce that burden. Please continue to show compassion for one another, as well as offer prayers for our co-workers who are on the front lines, working tirelessly to care for our patients and contain this virus. Be assured we're following CDC guidelines for personal protective equipment. I ask everyone to conserve supplies to sustain us through this pandemic. You've heard it many times, but it always bears repeating. Wash your hands. Don't touch your face. We know this is our strongest protection against this virus, and so I ask you to be vigilant in following those guidelines. I'm told a mask without hand washing is not helpful. In closing, thank you for all that you're doing during this difficult time. Please take care of yourself and each other. Thank you.